This is Jan Hodes with Ipsos, and I'm being joined by two of my colleagues, Raquel Ortiz and Bob Kasak. Bob works in our IT group, and he has a lot of experience in creating data portals and online reporting sites for our clients. Raquel is a senior member of our HCAPS team, and she also works on a lot of ambulatory care survey work in the healthcare arena. I'm the head of Ipsos Health Policy Institute, and we appreciate this opportunity to be able to talk to you about our credentials for conducting this work for you. Let's go ahead and jump in. You can see that from the content, what we'd like to try to cover today is just to give you a quick overview of some of our credentials, our partnership with Kaiser Permanente. Then we'll switch and have Bob talk to us a little bit about our online reporting tools. And then Raquel will speak to us about our reporting capabilities as well as our ability to do customization and benchmarking for the HCAPS and ambulatory surgery care. We'll move right on. Just wanted to give you a little bit of background. Ipsos has successfully teamed with the Kaiser Permanente group for over 20 years. We've conducted a number of patient feedback surveys on the care that's been provided, and we do that across several of your regions, reporting all the way down to the physician level in some cases. The current study for HCAPS and ambulatory surgery care would represent an expansion of that relationship to include your hospital and ambulatory surgery patients, and so we would welcome that opportunity to work with you with those new groups. We have the experience and knowledge to work independently because we are familiar with your organization, as well as having in-house capabilities for conducting complex sampling and weighting adjustments should those be needed. We're excited about Kaiser's adoption of the HCAPS and ASC surveys because they are widely vetted. They've been extensively tested. They are member-friendly. I think they'll work very nicely with your population. In addition, the HCAPS and ASC surveys do follow a very rigorous set of protocols, both for the data collection as well as the data processing. And Ipsos is very familiar with those. It also will provide you with a nice benchmark in the hospital compare data by which to look at your performance against others in the industry. And because these protocols and survey instruments are already set up and well tested, it will really minimize the startup time and the associated cost of getting a program like this put into place. As a long-tenured administrator of the CAPS surveys, Ipsos is well positioned to take on this task for Kaiser. We've participated year after year in a number of on-site audits and have been submitting the data to the NCQA since the program's inception back in 1998. And as a result of our performance, Ipsos holds the highest level of CAPS vendor certification of any vendor out there. So we can readily take on this challenge for Kaiser. We also have a very great capacity to take on large-scale surveys of this type. Just to give you an example, we think that Ipsos is the largest administrator of ambulatory and HCAP surveys since we are the provider for the Veterans Health Administration. And currently, we mail out about 600,000 surveys to their veterans receiving ambulatory care, and over 72,000 a year of the HCAPs to veterans being released from VA hospitals. So we can handle a very large volume of work. And we have an expanded team so that we can cover other critical program aspects for you. I'll provide the corporate oversight to make sure that you have adequate resourcing to get this work done. We do have in-house sampling specialists who can help us with the sample design, and we have sample management systems already in place to track respondents all the way from sample selection to completion of the survey and output into the data file. Our in-house statistical team can also handle sample weight adjustments as needed. If you do decide you would like to customize the survey instrument, our healthcare specialists have substantive knowledge of the industry and can help you create any particular measures or new modules that you might like to include in the survey. And we're very familiar with the various CAPS questions and scales, and so we can make sure that they fit in very nicely with the existing instrument. Ipsos has extensive data collection capabilities. We can administer these surveys for you by mail, by phone, online, using IVR, and we do conduct cognitive testing, particularly where we have brand new measures that we want to make sure are going to work the way we're expecting them to. The Ipsos team also has very large capacity for conducting the data processing and has verbatim coding teams already in place to take care of both editing and categorizing with themes the comments that we would get back from your patients. Ipsos has a wholly owned high-capacity CADI center in California that we would use to conduct the telephone follow-up for non-respondents. What I'd like to do now, let me just mention also the quality assurance. We do incorporate QA into every protocol that we administer. Ipsos, particularly the Health Policy Institute, conducts a number of very large-scale tracking programs, and we do follow best practices for managing those. We have very strict adherence among our teams to the NCQA protocols, both on the data collection and data processing side. And our team is HIPAA compliant and very familiar with those requirements. And let me turn now to online reporting, and I'm going to ask Bob Kasak to speak, if you would, Bob.
Thank you, Jan. Ipsos utilizes best-of-class reporting tools to deliver dynamic and static reporting to the web. We use a combination of common templates, reusable components, and a rules engine to process data. All of these websites can be customized to a specific project. Our system is designed with the user in mind. The site is easy to navigate, important information is easy to find, and reporting options are simple to use. Our reporting solution can accept data from the data collection systems used by Ipsos, as well as third-party sources including transaction data, patient history, facility information, and organizational structure data. These data sources can be seamlessly integrated into the reporting site and used to filter reports. Each user of the reporting website is presented only with the data, reports, and access required. This is all based on their role. Our report offerings include dashboards, tabular reports, respondent-level data, respondent comments, trend charts, and graphs. Let's look at some report examples. In this next slide, this demonstrates our tabular report examples. These summarize each survey question and cuts the data by time series. On the next slide, you'll see filters allow the user to customize the report to their needs. Let's go to the next slide, please, and here you'll see another example of a tabular report. This is a sample disposition report. One of the features of our system is to track each incoming record from receipt to end and also record survey completion, and when a survey is not completed, the report explains the reason why. This allows the users to understand what rules are applied to the data and the results of the analysis. Let's go to the next slide, please. And here, lastly, is our voice of the customer report. This allows the users to view the written comments of the respondent, or in the case of an IVR survey, a recording can be made available to the website user. As with all of our reports, this report may be filtered by time series, or any other variables. Jan, back to you.
Very good. Thank you, Bob. And now what I'd like to do is have Raquel begin to talk to us about some of our reporting capabilities, and then she'll move on to customization and benchmarking. Raquel?
Thank you, Jan. Now we will discuss our reporting at different levels. Ipsos is very experienced in producing reports and reporting systems that facilitate easy navigation and easy use of survey program results. We regularly produce results for all different types of projects in clear and informative formats that provide results that match our client organization hierarchies. For example, networks, regions, divisions, service lines, facilities, clinics, provider, and clinician levels. In other words, we are able to produce reports at any level and any summarization category that is required. Our reports include basic descriptive statistics and tabular, as well as many different graphical formats. Examples of some of these basic statistics are mean scores, sample sizes, response rates, statistical significance testing, comparisons with previous time periods, and benchmarks. This often includes current time periods as well as customization across time. For example, past 3 months, current month, and year to date. Ipsos in-house statistical consultants are an integral part of our project teams and provide sample weight adjustments to take into account differential selections and response rates across key respondent groups and locations. Ipsos in-house data processing teams regularly clean and code verbatim comments from patients. Our teams are fully trained and highly experienced. Our HCAPS and ambulatory care research teams are trained to review and process white mail and marginal comments. Screening and prioritization comments for client review is a critical part of our process. Rapid response for the treatment of urgent and dangerous situations arising for mail comments is of the highest priority. Our white mail processing follows very rigid protocols and is considered a critical part of the process. Great importance is placed on the treatment of these critical comments, and they are regarded as of the highest priority. Now we will move on to our customization capabilities. Ipsos can assist with customization for any phase of a project. Ipsos can assist Kaiser Permanente with the creation of custom questions, drawing upon our expertise in the healthcare field and drawing upon years of experience with CAPS protocols and scales. Survey materials can be customized for any needs: letters, questionnaires, postcards, logos, etc. Reports can be configured in any way useful for your organization. Ipsos would work with you to design reports based on your end users, regional directors, facility managers, medical chiefs, physicians, etc. Creation of dashboards and scorecard developments are often used to give our users a snapshot view of their results. In addition, we offer advanced analysis, for example, key driver analysis, and graphical modeling is often used to uncover and dig deeper into issues for better understanding. In terms of our benchmarking capabilities, Ipsos is fully capable of conducting data collection and data processing to meet NCQA standards for data submission for plan accreditation. We are compliant with NCQA protocols and timelines. This will enable Kaiser Permanente to use the Hospital Compare as a benchmark. In addition, Ipsos would work with Kaiser Permanente to create internal benchmarks, making comparison across regions, medical service lines, and facilities possible, as well as being able to do comparisons over time. With that, I will turn this back over to Jan.
Very good. Thank you both for walking people through this. I would very much welcome any comments or questions that you have, and would very much enjoy working with Kaiser Permanente as you go forward to execute the HCAHPS and ambulatory surgery care surveys. I've provided my email address and my telephone number on the front and final pages